Thank you so much for coming out today. I have a few things to put out to you. Lafayette Consolidated Government has filed a request with the Governor's Office of Homeland Security and Emergency Preparedness to provide qualified National Guard personnel to assist with and help staff at our mobile screening and testing site. We want to recognize Lieutenant Colonel Mark Premek, who's here with us today. Thank you, Colonel, for joining us. In addition to that, I just want to make it clear, National Guard is here to assist with our screening sites. I know there's a lot of rumors going around. Don't feed into them. That's not why they're here. We know a lot of people are feeling a lot of stress, a lot of fear and anxiety during this public health emergency, so we did want to put out some information. The Louisiana Department of Health has established a Keeping Calm Through COVID hotline. The service connects callers to trained counselors who can provide emotional support and referral to appropriate mental health services. The number for that hotline is 855-320-7977. 855-320-7977. It's available 24/7. Now, Mayor President Guillory has an announcement and will provide some additional information about our efforts. Mayor President.
Thank you for coming. Today, I issued an emergency order in response to the COVID-19 public health emergency, in addition to my previous order on March 15th. Effective at midnight and continuing until further notice, all non-medical personal services which cannot be performed with a 6-foot distance being maintained between the customer and the service provider shall be discontinued. Examples of such services include, but are not limited to, the following: manicures and pedicures, haircutting and styling, spa services, massages, applications of cosmetics, applications of tattoos and other body adornments, body piercings, and non-medical cosmetic procedures. Physical interactions between persons within a 6-foot distance of each other is strongly discouraged. These measures come as a result of the best guidance being provided by public health professionals and are consistent with previous statewide executive orders issued by the governor. Our mobile testing center had another successful day of operation. Our biggest surge traffic was at the beginning of the day, just like the prior 2 days. Operations ran smoothly, so there were minimal wait times. Our mobile screening process is turning out to be quicker, more convenient, and safer than going to a walk-in clinic or other healthcare facility. We had 146 vehicles go through our screening site today. 68 vehicles were screened out as not needing testing, and 78 COVID-19 tests were administered. So, we're testing more than we're screening out on site, which is the purpose of the process we have implemented. Our 311 line is proving to be an effective screening tool to limit the number of people who go to the Cajun Dome. Yesterday, medical professionals from SCP Health fielded 743 calls. 90 callers were referred to the Cajun Dome. 50 were referred to their primary care providers. 8 were immediately referred for emergency care. 34 were advised on home care. And the remainder of the callers were provided with general information on COVID-19. Tomorrow, Saturday, the Cajun Dome site will be open from 8:30 a.m. until 10:30 a.m. The reason for these more limited hours is that most of our vehicles are coming early in the morning, primarily during the first hour. And shorter hours help reduce the load on the site, the medical personnel, and our supply of personal protective equipment. We will provide guidance each day going forward on hours of operation for the Cajun Dome site. We still have additional sites on standby in case we need the additional capacity in the coming days and weeks. We're doing well with one site right now, but that could change. I want to thank everyone who's doing their part in this public health emergency, and I understand that these measures represent a significant inconvenience in most cases and a major burden in many cases. Our public health professionals tell us that these measures are necessary to limit the spread of the virus and prevent overwhelming our local healthcare facilities. The governor mentioned yesterday that the medical system in the New Orleans area could be over capacity in as little as 7 to 10 days. We want to ensure that we stay on top of this emergency so that doesn't happen here, if at all possible. That said, I'll take your questions. Yes, ma'am.
Cassie Sherman, News 15. Are there any plans to close the mall or any large shopping complexes?
Not at this time. Any other questions?
What about the testing Sunday, Monday?
First, Claire, I'm glad that you have a chair and that you're not sitting on the concrete. See, I care about your well-being. Now, what was your question again? I'm sorry.
Sunday, Monday, are y'all going to do the K-to-know?
Yes, we will, and we're taking each day one step at a time in regards to the hours of operation after talking with our healthcare providers on site. And we do have Dr. Doug Claymore with us, who is our Chief Medical Officer for the Parish of Lafayette. And he can field some medical questions should you have any questions. And he's also one of the medical doctors that have been on the site all 3 days. So he has good field knowledge and good personal experience. So I encourage your questions to that. But we'll take it one step at a time, Claire. So good question. Yes, sir.
We heard about possibly the demographic of people who may be affected could change over time as we learn about this. Have we seen any changes in those demographics?
Dr. Claymore could probably answer that better than I can. I will say this, my understanding of this virus, it's new. It's new to us. So the demographic that it affects, we heard one demographic when we first heard of COVID-19. It's ever changing. So it wouldn't shock me if there was a change in demographic. Yes, sir.
New precautions, you said until further notice. I know you said you're making decisions 15 days out at a time.
Yes.
Is there any end date? Can you say why you sort of are deciding until further notice for those precautions?
Sure, and we are making decisions based on a 15-day increment, or in 15 days increments. And again, we said this a couple press conferences ago. Our local government is prepared at many levels, to doing level 0, doing nothing, all the way to a full quarantine, which has not been issued. I don't want any rumors going around, and I'm watching you. I'm joking, but that's right. No quarantine, but we're prepared at all levels, So I take the advice of the medical doctors. We have a solid healthcare team. We have a solid task force led by Dr. Tina Stefanski. Dr. Claymore is on our task force, and these are the professionals. These are the healthcare providers, and I'm in constant communication with our medical task force. When they give me a medical reason to increase our level of preparedness, I take action. And right now we're following what President Trump's trend has been to implement changes in 15-day increments. I think it would be a little overkill maybe to go 30, 45 days at a time. I'm not criticizing anybody that has because I believe it's good faith, all those measures. Yes, sir.
Mr. President, as far as the assistance of the National Guard at the screening sites, what is the...
So we made a request to the National Guard, and this came from a local request, and it has not yet been approved. I don't anticipate any obstacles, and I'm so very blessed to be here with the good Colonel and some other fellow soldiers out there. But it's a team effort, state effort, national effort, and as you can see, it's a global effort at this point.
One more question for the Mayor President.
Yeah, what are they going to do?
What's that?
The National Guard.
Can you say it again?
What are they going to do?
Oh, the National Guard?
Assistance are they?
Oh, okay. Well, they can help with a variety of things, depending on what their military specialty is. But they can help with screening. They can help with security should they need it. If they have any medical doctors, they can, or medical doctors available to them and to us, then they can help with actual diagnosis or going through the screening process. Are there any questions from a medical nature that you would want to ask Dr. Claymore?
We do have one from a viewer.
All right, doctor. And thank you. And again, I want to say thank you for what you do. It's very honorable. I appreciate you allowing us to have this opportunity to give this very, very important information to your viewers and to our communities. And it is an honor to serve as your Mayor President. That said, Dr. Claymore.
Yes.
So we had a viewer ask, what about the mail people? They're kind of nervous about it getting transmitted through mail.
Okay.
Do you want to comment on transmission about
The transmission of the virus right now is understood to be droplet precautions, that if you sneeze on something or you cough on something, it needs to be cleansed right away. As far as the mail goes, unless you're sneezing or coughing on the mail, you can wear gloves and you should be protected from the virus itself. Correct.
Many salons, other beautician places have been saying all week that they've struggled to maintain social distancing while performing their duties. Why? What's changed between, say, Monday when other businesses closed and today where we made that call?
It's being in close contact with